Hi everyone, and welcome to our virtual Lunch and Learn today to learn more about AesthetiCare's new Revive and Thrive hair restoration program. My name is Blake Bryant. I'm one of the nurse practitioners here, and for over a year and a half, I have been studying and trialing everything that we're offering today, and we have some amazing results that we want to show you. I want to walk you through the process. Just a couple reminders today. You'll be able to submit your questions via the question and answers tab, so make sure that you ask anything that pops up, and we'll answer those at the end of today. I also want you to stay so that you can get registered to win our giveaway. We're giving away a full treatment, and we will even have discounts for everyone else. And then you can book a consult, and after today's visit, we can chat one-on-one about more about the program, go over your individual questions if you'd rather do that one-on-one. So let's talk a little bit about the program overall. So when we look at hair care, you might have seen ads on Facebook giving you one product, or you might have heard a solution a friend has done. But the way that we looked at it was we take care of all of our other areas of our body in multiple ways. And for our hair, we kind of have a bland routine, maybe a few products here and there. But the way that our Revive and then Thrive program is we want to be able to take care of it and throw everything we can at it in multiple avenues. So we have multiple mechanisms that we're trying to improve. So our program includes things like painless in-office treatments. They're more like a scalp massage with cold water and cold air. We give you products to use at home. We help you optimize your regimen with your own hair care products. We give you a low-level laser cap that you can do at home on your own indefinitely. It's yours. And then we also customize by looking at your medical history, reviewing things. We'll do trichoscopy, which is like taking a microscope and looking at your hair and scalp, and you get to see that process so that we can really go, you know, we're working with a generic kind of alopecia here, or maybe customize more for what we see in that assessment. And that's kind of the beauty of that. That's something that we can offer to our patients, to be able to like customize it, but then be able to throw everything in the kitchen sink at your hair. And it is something that you can do easily at home, a little bit in office, and then set you up for success for the long term. So the first step in getting involved with our Revive and Thrive program is the consult. This is where you would meet with me one-on-one, and we would chat a little bit about what you've done to your hair to try to get it to improve over the years, what has failed, what has worked the best. A little bit of genetics, not too much. There's not a lot of evidence that says we can predict everything just on genetics alone. In fact, stress and nutrition are really important because they're big factors outside of our biology that impact our hair loss. We'll kind of talk about the aesthetics of your hair, what treatments you like to do, and then we'll kind of review with trichoscopy, which is a microscope I can put on your scalp, and we can look at the follicles, we can look at the shape of the shaft of the hairs, I can see different densities and clusters, and we can really together see how much change we can get in the scalp. And then we will go over how to use all the products, go over the process, what the next 12 weeks, 6 months, 12 months looks like. And we'll walk you through the steps at that point, and we'll have some amazing photos to take at the beginning, and then we'll kind of start working you through the treatments. So after the consult, we will kind of set you up with everything that you need for your treatments. And a lot of the treatment is actually what you get to do at home. So you'll walk away with some goods when you sign up. Part of that is some products you use at home, a serum for the scalp and an oral supplement. All safe, really natural results come from slow, steady nutritional supplement and supplement at the follicle base. So that's one of the key components that really is the thing that consistency over time is really going to yield a good result for you and your hair. It's not just a nutritional supplement, it has mechanisms of action similar to finasteride and minoxidil, so it's working in specific pathways, but it's safe for both genders and doesn't have really any side effects that I'm looking for as a medical provider. The other thing you're going to walk away with to do at home is a low-level laser cap. And the brand of cap is LEDs and near infrared LEDs that are going to stimulate the follicles to be longer growing seasons and shorter, like smaller, kind of we always say longer springs, shorter winters. And that cap has a lot of evidence in it. There is plenty of research on the internet you can find about using lasers for the scalp. It's safe, it's less than 6 minutes. You just kind of pop it on and do your thing. And those are some big components that you'll have from doing the treatment. You'll also be set up for some appointments in office, and there is some initial treatments we do in office. That is through what we call carboxytherapy, or CO2. And it is just cool CO2 gas that we use to push through a really big moleculed serum. And that serum is what really expedites your results to help you start to see things really early. Normally hair success shows up at like 6 to 9 months, maybe 12. We're trying to push that closer to 4 to 6 months. So really trying to get you to see results that take a long time to see, and just increase that density, that really long spring season, and hope you start to sprout some new denser hairs. So for most people, the treatment options that I've already laid out will cover most hair types and growth and improvement to their maximum genetic capacity, right? That's gonna be the coup de grace, that's the best treatment. For some people though, there's a little customization needed. Maybe there's a specific reason that their hair has changed over time, or there's a date where they really want to put every piece of energy into getting their hair to be as strong as it can be and as dense and lush. To a certain point. Maybe it's a wedding, maybe it's a big trip, maybe a family reunion. And so sometimes we want to boost maybe a little bit more than just the initial time. So our boosting options are custom for you, but we don't have to do any of them. I want everyone to feel like they're just that extra kind of icing on top of the cake. So we can boost with some more carboxytherapy treatments. That is certainly what I think a lot of my patients in the studies liked, was being able to go back to that a year later and get another little boost. Certainly we can look at exosomes and growth factors. So the CO2 system can deliver different types of liquids. So we have growth factors, we have human-derived exosomes, we can be able to deliver those to the scalp for certain medical conditions or inflammatory conditions. Those are great. So I'd work with you and your dermatologist to kind of pinpoint what would be great for you. And we can even talk about some options like PRP and PRF, although the evidence is limited, and as far as comfort goes, it's a dramatic increase in sensitivity in the scalp and in aftercare, and I'd rather keep you kind of on the easy, simple path. So after you've kind of been in the program and we've worked through the in-office treatments, we usually will plan for 12 in-office treatments initially. So in the first 6 months, we'll see you about 12 times. And we'll chat at those quick appointments. They're literally less than 5 minutes of treatment. It's that in-office carboxytherapy, so it's like a cool scalp massage. We'll get to chat a little bit about your hair care, what progress you're seeing, what changes you're seeing, and kind of time it over time. That being said, looking at yourself every day in the mirror, it's gonna be really hard to see much growth. Now, I'm excited if you do, and we kind of talk about that again through the office treatments, but we'll wanna take photos again at 4 or 6 months, either what we call macro photos from far away with our digital cameras or with our microscope, to be able to show you the change from day 1 to day 120. And that's really where we start to see the progress. But that is just the first change. There's going to be follow-up over a year. So typically at 6 months, you would transition away from in-office treatments, and we would just resupply you with your home supplement serum, and then you continue to do the laser cap. And that is what you do forward. You can do it indefinitely. We'll follow up every 6-ish months to just see how things are going, what other events, maybe other health issues are impacting your hair, and we'll kind of make sure that we're staying ahead of the game. Once we get you revived, then we just go into the thrive. And that is easy as just continuing your home products and your low-level laser cap as much as you want. Often when people start to begin to look at hair restoration, they come across surgical treatments and surgical results. And a lot of times they're either really intimidating, very expensive, or they're maybe not the best candidate for it right now, but they still want improvement. We have found through our trials and our studies that people who can get in early start to see more results and have better lasting results than if they wait till things are too gone. And this has actually been well studied since the 90s, where surgeons who do hair transplants actually look at the density of your hair, and their goal is just to get you above 50% of your original density, because that's when the eye starts to not really notice how thick the hair is, and that's good enough for surgery. What we have found is that people don't really notice they're thinning until they're under that 50% mark. And so our program has been designed to really help push you to that 50% and above and optimize your hair the way it was when it was most at its healthiest. And what we see is that even if you were considering surgery in the future, getting this type of hair restoration really gets you the best results for your future surgical intervention, because we've grown the right crops at the right time and they're really strong and resilient. And maybe the surgeon then doesn't have to do as much or as critical movement. Or if they're donating from certain sites on your scalp, you've prepped the donor sites well enough that you're gonna have a really higher success rate. The success rate of surgical transplants is not the highest. There's so many factors. Our success rate with our hair program has been well into the 80%, and that was only cut off at 4 months. So we really don't know, even if they got to 6 months, how well they were doing further into the treatment regimen. And that is a thing that we absolutely love. I want to be able to walk you through the process, really understand your hair at the beginning so that I can help guide you through the process. And then eventually, I love the fact that we named it Revive and Thrive, because my goal is to just let you live your life, just thrive and enjoy what you have, whether you do end up at surgical results with that as a potential future. I'd love to even give you recommendations of local surgeons that we've talked to. There are a lot of things out there, and I just want to make sure that you have the right facts and you have good science behind it, and I'm able to conduct that with you in our office treatments and our follow-up appointments. So thanks for joining us at our Lunch and Learn today. Please stay for the Q&A and ask any questions, hear other people's questions and answers. Will be very helpful to kind of go, where is everyone at with this whole subject? Is it new to everyone as it is new to me? It's a very genuine conversation when we can be able to answer your questions, and I want to make sure that they're addressed today. Also, make sure you check your text messages after the Lunch and Learn today and respond back if you want us to reach out to schedule a time that best fits for you for a consult with me. Our staff will reach out to you after they see that and get you registered. And then we will notify the winners of the giveaway today. So just make sure you check your emails or phone numbers so we can give you a call and let you know that you've won. And I look forward to hearing all your questions in person. Awesome, everyone. Thank you all for getting through the initial part of our today's talk. I am Blake, as you have seen. I'm live right now looking at some of the questions that have been coming through the presentation. And so if you have anything that comes up, please feel free to ask. There's already some really good ones in there, and I want to make sure I go over most of them. I will say, though, that we love to do a consult. We love to make this very custom for you, and we like to spend 40 minutes with you going over all of this in person. So if there's something that's very personal, we can talk about that more in person. And I am going to kind of go back to the beginning, and we're going to start with the first couple of questions. The first one's actually a really good one, and I didn't even think about that before. But I know that in the last couple of months, we've been talking more about it. But does semaglutide or Ozempic affect my hair, or did it cause some of my hair loss? And so what we know from evidence is that the hair loss that's associated around that is not probably directly linked to the drug itself, but it's actually called energy. And for some reason, it wants to kick out old hair, sprouting new ones. And so it is likely that your body just actually kind of decided to fertilize your hair and that you shedded some to create some new. It's actually inversed when you get pregnant. And so that was another question, and I'll jump right into that one too. And so just to be clear, Ozempic doesn't directly cause hair loss, but it is noticed that there is some temporary hair thinning, and that over time it would go back to kind of maybe your baseline. With pregnancy, though, normally we get bigger, like fuller looking hair, we get stronger strands, we get more density. And then usually at the other side of pregnancy, sometimes that will reverse. So the ingredients in everything that would go inside the body or topically are technically safe, but not all of them have been studied individually to say that they're safe in pregnancy. With a lot of things that are out there, we don't want to study it if we don't have a lot of reason to or whatever. That being said, your hair is usually better during pregnancy than it normally is. And so after pregnancy, that's a great time to actually jump into this program, because throughout your pregnancy, everything's kind of shifting over a couple of months afterwards. You're rebounding, but the changes still linger, and we can actually kind of pick up at that time frame and then maintain the hair quality that you had for a while, so that your revive portion, or the changing of the seasons analogy that I used earlier, doesn't actually have to make as big of an impact, and you can actually keep springboarding from that. And then the other two things are, will the new hair growth be gone as soon as you're done with the program? And similar to that last vibe of like springboarding and staying ahead, it is not a predictable, it will go down and be gone immediately. You guys probably just saw that pop-up. This is one of the pop-ups that you'll see. You can just skip it and look at your text messages, or you can answer in that pop-up that just happened. Getting back to kind of the question. So when we elongate the spring, the growing seasons, we elongate the harvest season. Basically with hair on your scalp, it can stay there for 5 to 10 years if you're letting it grow before it falls out. Now, I like to remind people that the beginning of your hair growth cycle is shedding. So you lose about 150 to 300 hairs a day on average. If you don't wash every day, they come out the next time you wash, or if you have product, they'll stay in your scalp. But to kind of start the growing cycle, they pop out the old follicle and then they make a big new bowl and they fill up the new shaft through that. And so in the beginning, you'll actually notice more hair, like in the drain or in your brush, and that's totally normal. My gentlemen don't typically notice that because they have shorter hair. And so it falls out kind of more randomly throughout the day. But when you stop the revive part, your thrive portion helps maintain the results. And the analogy that I like to give is, if you're prone to like dental disease, or you have sensitive teeth or thinning enamel, your dentist probably tells you it's more important for you to brush your teeth daily, to come in regularly for my appointments, and then you'll probably be seeing me for the rest of your life occasionally for dental concerns. It's just the hand that you were dealt. Your genetics kind of predispose you to that. With hair, it's the same thing. We need to optimize your care so that every day you're doing better things for your hair, and that you're doing these kind of like in office as your dental hygienist appointments, where I can kind of help keep you getting ahead and staying from backwards. And then over time, eventually, yes, your genetics will catch up in different decade. I think a great example of this is, like, let's say you're getting married in the next few years, or you have family married. I don't want to be losing more hair up to that date. I want to try to improve it up to that point. And so this is a great way to do that. Another one, I lost my hair because of chemo. Can this help me? So that's a really good question. So there's actually already studies done with the same program, basically, the same products and then the same process, that as soon as you're post chemo and you've stopped your therapies, so in chemo, our most aggressive cells are being destroyed because that's cancer cells. Well, that's usually skin and hair, and that's why our hair falls out. When your doctor gives you the, okay, we're not going to be doing any more chemotherapy, you might be doing other types of things, but once they say you're probably going to start sprouting some hairs in the next couple of weeks to months, that is a great time to come in. As soon as you start seeing those little sprouts, come on in, and I can help, one, reestablish healthy quality tissue so that you can grow the best hairs, but also I can help accelerate that so they all come in quickly and together. Because it's all natural, these are plant-derived ingredients, they're targeted, focused at specific pathways. They reduce inflammation, they promote blood flow and oxygenation. These are things that we want post-chemo. So they're very healthy things. And then I've also had a couple patients who said, oh, I've had breast or ovarian cancer, I can't have hormonal treatments. This is not in that category, so it's totally safe in those situations. Somebody said, what is the benefit of the carboxy serum? So carboxy therapy is that CO2. We actually breathe through the carboxy kind of pathway. So when there's too much CO2, it forces the body to put oxygen there to counterbalance it. And so by putting CO2 on the outside, we force oxygen from the inside to meet it at the tissue. The other great thing is it changes your skin's pH. So we're slightly acidic at baseline. This really drops the acidity and it freezes our cells open, and we can put really big molecules between our skin cells. And then when the pH rebalances, it seals itself off. So it's a form of getting things that are normally hard to penetrate deeper into the skin. And it's a really great tool. So the serum specifically in the office it's biosimilar to what you're doing at home, but it's large molecules. They're dense, they're concentrated, and they just can't penetrate at home. And so it's of a lesser form at home than what it is. The in-office treatment, the home serum, and the home supplement are all called trichocyte. And so all of those things would be established baseline in evidence by themselves. And so we're just kind of accelerating the results, like I said. And just for time frame, because I think a lot of people even go, oh yeah, 4 to 6 months. Like I get that. Yeah, I'm okay being patient. 4 months from now, we are going to be going to our families for Christmas or getting ready for the holidays. And in 6 months, your first real follow-up where we kind of compare your before and afters, you will be getting ready to go to spring break. That's just a long time frame. And I think a lot of people, I want to make sure that's always really clear because it's a slow burning process, so to speak. And so what is the cost? So the program is broken up into Revive and Thrive. And the Revive part is that first 6 months. And that's when you get all the goods. So you're going to get 6 months of serum, 6 months of supplements. You're going to get 6 months of in-office treatment, and you're going to walk away with your LED cap, which, by the way, I'm just going to show you how easy this is. I literally brought it into the room. This is the LED cap. It is just a nice little cap. You can put whatever cap you want on the outside. But I literally do this when I'm charting on patients. You just turn it on. It won't turn on until you put it on your head. And when you do, it will set in there and the light will come on. And then you just sit here for 6 minutes while it's doing its thing. So I'm just going to do it while I finish up the conversation with you guys. So the cost is broken down into Revive. We'll go over it again in person. But that first 6 months is $3,500. So 6 months of everything. It includes your lifetime cap that you'll walk away with, all the best practices, my assessment, my follow-up, and then all of your supplies. And then going forward, every other 6 months is what we consider the thriving portion. And 6 months of that is $1,700. And so we have different ways that we can help spread that cost out if you want. I also, I've seen it happen so much that it's worth mentioning that HSA kind of works best when we can kind of call a medical diagnosis associated with the treatment. And so we can talk about maybe HSA being an option for you. Does it matter what type of alopecia you have? So great question, because the best candidates probably have a little bit of different alopecias or genetic predisposition because they're going to get a general response. If your alopecia is central scalp traction alopecia, where you have a distribution that's really focused right in the center, if you have alopecia areata, where you have patches all over, my ability to choose and pick just those patches to regrow is limited because I'm going to help all of your follicles get better. So if general global health will help that, and that density will help mask those individual spots, it works really well. Hair, the reasons we think about our hair, it varies in everyone, but really relationships and work and confidence are central to that. And then looking healthy and being able to wear the hair that you like the way you want is really important. And what I have found is I've had gentlemen with almost the same pattern, and a couple of females actually very similar too, where their concerns were opposite. One was only adamant about his hairline, and the other one wanted the back of his hair. I've had a female who's like, oh, no, I just want to be able to wear my wig without it hurting my scalp. And then others have said, oh, I want to avoid wearing wigs at all costs. So that's why we do the consult, making it very personal, making sure your goals are going to be met. And so that's a really good question. We talked about the serums. It's all in the same brand, so I'm going to keep you very consistent. And again, it's called trichocyte. It's been studied by itself with a 9-month kind of baseline measurement. And so when I said we're trying to really expedite that, that's where that 6 months, kind of 4 to 6 months is our goal, is starting to see the results. And honestly, a lot of times we can see that through the microscope, but we get about, on average, an adult in the United States grows about a half an inch of hair every 3 to 4 weeks. And so it's really hard to kind of see density or layers depending on your hairstyle. Weirdly enough too, and I didn't know this before, like I started researching this years ago, but blonde hairs are actually thicker, they're denser, and you have less of them over your scalp. Dark hairs, you have more of them and they're thinner. And so even that sometimes comes to play. When we look at trichoscopy and you're holding an iPad and you can kind of see your follicles, I'll point out the average density that we're seeing. We'll count how many units are there. And that's really fun because I can't always go back to the same spot, but we'll look in that same area and count again in 6 months. And that's where we can kind of see the changes together. Great question. So can I do the carboxy without the cap or at-home serum? So I would tell you it would be inconsistent with the studies that we've done to see results by doing just the in-home treatment without the cap or the at-home process. Just like when you go to the dentist, you have to brush your teeth daily so that the cleanings can keep you ahead. You have to do a little bit every day so that the balance between the treatments work. And in fact, if you did nothing but massage your scalp, you would actually get a change in density over a year. There's been studies that kind of show that just like using the fingertips. So when we talk in person, I'm going to encourage you to massage your scalp. There's evidence that says just the cap alone will get you about 5 to 12% of your hair density increase by itself, doing nothing else. Changing your shampoo, doing a little bit of this, a little bit of that, they all add up. And so together as a group, that is why we have this called the hair restoration program, because unlike a Facebook ad that's just one pill or, over-the-counter minoxidil, and when you stop it, the changes are there. It's these kind of things that have not been done together before. And that's why we are so excited to bring everything in the kitchen sink together, because we're really building everything into one thing. So the thing with the cap is, so this has about a minute left. It gets like you can move around, it stays on your head. The only thing that we will talk about at your consult is just the cap you can't have like wetness on your scalp at the time, because water refracts light and we want that energy going down into your scalp. But other than that, you can kind of do the cap whenever. You can put it next to your bed and do it while you're reading. It kind of gets a little warm towards the end because of all the good energy that it's putting in. Not hot by any means, but it can be kind of a nice comforting thing. You can do it while you brush your teeth. It doesn't make a difference. Just as a reminder, before we get closer to the end, and if there's any questions, feel free to put them in. But you're going to get a text message during this and right after. Please reply with it with the keyword that it says, which is revive, because we'll reach out to you to get you scheduled for the consult. And then over the next week or so, we will be calling you if you are the winner. So make sure that you have AesthetiCare in your phone and you'll know when we're there. And then that's it. That's the end of the cap. So we're done and I can go on with my life, just like you guys are going to do at home. No one asked it, and I totally thought somebody was going to, so I'm just going to do it. What does the serum feel like? What is my hair going to feel like after doing it? So after the in-office treatments, those 12 in-office treatments that are done every other week, your hair is going to have a little bit of a thickness product on it. And it doesn't go away immediately because we really want it to set into the scalp. So basically during the treatment, I'll massage it all in, the rest of the product, but you'll leave looking a little wet. So I suggest not going immediately to the gym, not going out with a friend immediately after, because we want that really good in-office treatment, that boosting serum, to really penetrate. And so that night, even if you can avoid showering that night or doing your shampooing, I would avoid it. It doesn't really matter if it's not, because I'm really only counting for an hour. But the daily serum, I call it a serum. It pumps like a foam, but it immediately turns runny. That serum just needs to stay on for 30 minutes. So if you're somebody who gets ready for a long time in the morning, and that's when you normally do your shampooing, you could do it first thing when you wake up and then go on with your day and then rinse it off a couple hours later. Same thing for my shorter hair people. It actually dries pretty thin, and it doesn't add a lot of volume to the hair or anything. So people can style their hair with that thin product. It is in the beginning, you are going to see some scalp skin changes because that skin up there is usually a little sensitive. Like if you've ever scratched your scalp and you said, oh my gosh, this feels really good, that actually means that your scalp is needing to be a little bit more invigorated. And so in the beginning, you'll see some cell turnover. You might even actually feel like the scalp skin is changing. You're getting more sensitive there. It's feeling stronger. So you'll notice those changes. And then after about 2 to 4 weeks, you probably shouldn't notice anything different with your hair. I would actually really want to know if you're feeling like your skin is getting really, really oily, because it might be actually a type of alopecia that we're uncovering as we're treating you. And that's why I work with your dermatologist. My background is in medical dermatology, so I would see people for different things. And so no one asked about beard or brows, but this is something that we will talk about in your consult. The supplementation you're taking systemically isn't going to make you grow hair everywhere. And it will even out even if you have a hormone imbalance. So it will help kind of redirect some of those hormones. So it should help globally with normal hair. That being said, if you have patchy beards or you have a part of your thin brow, we will talk about maybe doing a little bit of the serum in your brows or on the spots of your beard to help really focalize those changes. But I wanted to kind of make sure that you all kind of heard a little bit of everything. So somebody asked about Nutrafol, and that's a really good question. So Nutrafol, and I'll give you this sheet if you want when we consult, but Nutrafol is a nutritional supplement. So its ingredients are things that you can get in your food, daily intake through food. A lot of those molecules, it is not science-based to say that it will go from the pill inside your body and absorb it and then get to the hair follicle. That being said, for some specific instances, like their vegan formula, their pregnancy formula, there might be some ways that like while a temporary time of life where a lot of stress or some hormonal changes or pregnancy is happening, it will help stabilize your nutritional supplement so that you don't have a lot of hair changes. But to say that Nutrafol alone will do it, it's just been too long. It's been out and well studied that it's not the strongest formula. That is why we looked at a formula that was actually targeting things like finasteride and Propecia and minoxidil do, because it's those mechanisms of action that are focused that help us get a better result. That being said, if you were on Nutrafol and joined the program, it might behoove us to not change your Nutrafol supplement in the beginning and just keep it. Because it's not going to harm you. It's not going to hurt. But there's just limited evidence, and to correct like a full alopecia, it would be only one piece of a big puzzle. Just like if you were going to do surgery and you were looking at a transplant, a lot of them will say, if you're not already on something like this, get on it and keep on it, because we want to optimize as best we can. We've just found a different combination of things that get better results. Again, it's because it's all working in a group, all targeting the same things. And just to mention that stress is probably more than diet actually linked to hair loss and hair retainment. So acute stress can change your hair over 4 to 6 months, and not like you could have like a really stressful 2 weeks and it will impact your hair that grows in 4 months. So we really want to target that. So that's why our inflammation pathways are in the program. But I have seen actually quite a few people who can pinpoint like, COVID and changing a job and moving to a different city and selling the family business. I was just really stressed for about 9 months. And that's when I started to notice my hair thinning. It's usually just the straw that breaks the camel's back. All righty. And maybe look one more time to see if there's any questions that I didn't get to. You guys have been great, so attentive, actually great questions. Again, if there's anything that's more complicated or something that would be in your medical history, that's what I do during your consult. It's a 3-page paper that you fill out and I will go over it. And then we'll kind of make sure that we're not missing anything up. So I can't wait to meet all of you in person. I can't wait to meet those who win. We'll follow up and get to show you more photos as we get more successful things on Instagram. You can follow me at Skin Fitness KC on Instagram. Follow AesthetiCare's page so you can see all of the good things like these and future events. And then I'll see you as soon as I can, and we'll get this show on the road. Thanks, guys.